Picture the last time you reheated something from the fridge. Maybe it was dinner from the night before. Maybe it was a quick breakfast before your day got started. You pulled out the container, popped it in the microwave, set the timer, and walked away. Nothing about that felt like a risk, and that's precisely what makes it worth talking about. My name is Dr. Carter, and over the course of my career, I've reviewed more patient histories than I can count. One pattern keeps showing up quietly and consistently among people who developed serious illness despite living what looked like healthy lives. It wasn't their genetics, it wasn't their weight, it wasn't even chronic stress. It was something happening in their kitchens, specifically in how they handled food the second time around. Today, I'm going to walk you through 5 specific foods that go through a dangerous chemical change when they're reheated. Not dangerous in a vague, general sense, but in a precise, biochemically documented way that becomes significantly more serious after the age of 60. And here's what most people never hear from their doctors. The real danger isn't just food poisoning, it's about what these reheated foods do at the cellular level over time. How they quietly feed inflammation, how they accelerate damage to your arteries and your DNA, how they silently create the exact conditions that doctors see building for years before any diagnosis is ever made. We're not talking about one bad meal, we're talking about a pattern, a daily invisible pattern that could be working against you right now. Stay with me through all 5 foods, because the last one on this list is something most people eat several times a week, and what the science says about reheating it may genuinely change how you look at it forever. And before we dive in, if you find this kind of information valuable, go ahead and hit that like button and subscribe to the channel. We upload helpful videos every single day, and we'd love to have you with us. Now, before we get into the list, I want to give you a short but essential piece of biology, because without this foundation, the rest of what I'm about to share won't land the way it should. Your body is under a constant low-level assault every single day. Damaged cells, reactive molecules, minor toxins, microscopic invaders. At 35, your body handles all of it almost invisibly. Repair systems are fast, the immune response is sharp, and the liver processes harmful compounds efficiently. After 60, that landscape changes. Not because you're falling apart, but because the margin for error gets narrower. Your liver metabolizes substances more slowly. The lining of your gut, which acts as a protective barrier between the food you eat and your bloodstream, becomes thinner and more permeable. Your DNA repair mechanisms, the internal editors that catch dangerous mutations before they can take hold, begin working at a slower pace. What that means in practical terms is that low-level toxins your body once cleared easily now linger longer. Inflammatory signals that used to fade within a day can now simmer for 3. Cellular mistakes that would have been corrected sometimes slip through the cracks. This is the internal environment where chronic inflammation thrives. Chronic inflammation is not what you feel when you twist your ankle. That's acute inflammation. It arrives, does its job, and leaves. Chronic inflammation is entirely different. It's quiet, it's persistent. It runs in the background like a program you never open but can't quite shut down. And it is the common thread running through the 2 health threats that concern me most in patients over 60, cardiovascular disease and abnormal cellular growth, which we more commonly call cancer. Every food on today's list, when reheated, adds fuel to that fire. Some produce chemical compounds that attack arterial walls. Some generate substances that international health research has classified as probable human carcinogens. Some disrupt the gut in ways that send inflammatory signals directly into your bloodstream. The chemistry behind all of this is well documented. Let's get into it. Food number 1, eggs. Let's start with something almost universally considered a nutritional win, especially for older adults. High in protein, easy to digest, nutrient dense. Eggs seem like the perfect food. And in many ways, they are the first time you cook them. Here's what almost no one tells you at a routine checkup. Eggs contain cholesterol. You already know that. What most people don't know is that there's a significant difference between cholesterol in its natural state and cholesterol that has been oxidized, chemically altered by heat, light, and especially by reheating. When you cook an egg and allow it to cool, the cholesterol inside begins a slow oxidation process. When you reheat that egg, particularly in a microwave, which heats unevenly and creates intense hot spots, that oxidation accelerates dramatically. What you're left with is a group of compounds called oxysterols. Here's why oxysterols matter to you specifically. Research in leading cardiovascular journals has linked them directly to endothelial dysfunction, which is damage to the delicate inner lining of your blood vessels. Oxysterols are absorbed into arterial walls, where they don't merely cause inflammation. They actively promote the formation of foam cells, one of the earliest structural building blocks of arterial plaque. For someone over 60, whose arteries are already less elastic than they were 2 decades ago, adding a regular serving of oxidized cholesterol is like dragging sandpaper across a surface that's already worn thin. There's also a second layer to the egg story. When a reheated egg, particularly the protein-rich white, undergoes what's called protein denaturation, combined with Maillard reaction byproducts. The proteins break down and reform in ways that produce compounds your gut struggles to process. The result is localized gut inflammation. And as I mentioned, gut inflammation after 60 doesn't stay contained. It travels. The solution is beautifully simple. Cook your eggs fresh. They take 3 minutes. This is one scenario where meal prepping genuinely works against you. If reheating is truly unavoidable, do it on the stovetop over very low heat, never in a microwave, and never more than once. But honestly, just cook them fresh. Food number 2, seafood and fish. This one surprises people because fish, especially fatty varieties like salmon, sardines, and mackerel, is one of the most recommended foods for heart health after 60. The omega-3 fatty acids in these fish are genuinely powerful anti-inflammatory agents. So why does reheating them become a problem? Because omega-3 fatty acids are polyunsaturated fats. That means they have multiple points along their molecular structure where they're chemically vulnerable. Heat causes these fats to oxidize. The first time you cook fish, some oxidation happens, and that's manageable. When you reheat that same fish the next day, you're applying heat to fats that are already partially oxidized and far more chemically unstable. The result is a cascade of oxidized lipid compounds, including one called malondialdehyde, or MDA. MDA is a byproduct of fat breakdown under heat. It has been studied extensively and is classified as a mutagenic compound, meaning it can directly damage DNA. It's also a potent pro-inflammatory agent that specifically targets arterial tissue. Here's the painful irony. You eat fish to protect your heart, but reheated fish may be doing the opposite, delivering oxidized fats that stress the very arteries you were trying to protect. Now, there's also a bacterial concern with reheated seafood that's uniquely serious after 60. Fish and shellfish can carry specific bacteria that thrive in cold storage and survive reheating if internal temperatures aren't uniformly reached. Older adults face higher risk here because immune function naturally declines with age. What might produce a mild, brief illness in someone younger can become a serious systemic infection in someone in their 70s. The answer is straightforward. Eat fish fresh on the same day it's cooked. If you have leftovers, enjoy them cold the next day over a salad or grain bowl. The omega-3s are still fully intact. Cold doesn't destroy them. Heat does. So eating your leftover salmon cold isn't settling for less. It's actually the smarter choice. This is one that rarely comes up in mainstream health conversations, and it should. Mushrooms are genuinely impressive from a nutritional standpoint. They're rich in antioxidants, B vitamins, and beta-glucans that actively support immune function, which becomes especially important as we age. But cooked mushrooms left overnight and then reheated are a very different proposition. Mushrooms have an unusually complex protein structure. When you cook them, you begin breaking those proteins down. When you store them and let them cool, bacterial activity begins converting those partially broken down proteins in ways that generate what are called biogenic amines, compounds like putrescine and histamine. You likely know histamine as what your body produces during an allergic reaction, but dietary histamine, the kind that enters your system through food, can trigger a different set of problems. It causes vasodilation, inflammatory responses in the gut lining, and in people who are sensitive to it, which becomes more common with age, it can cause symptoms that mimic an allergic reaction without any obvious allergen. When you reheat those mushrooms, you're not destroying those biogenic amines. Heat doesn't neutralize them. You're simply warming them back up and consuming them. For someone over 60 with a more permeable gut lining, elevated dietary histamine doesn't stay localized. It contributes to what researchers now call low-grade systemic histamine load, a state of mild but persistent immune activation that hums quietly in the background, feeding the same chronic inflammatory environment I described at the start. There's also the matter of purine content. Mushrooms, particularly after extended storage and reheating, release purines in higher concentrations. For anyone managing uric acid levels or at risk for gout, which becomes more common after 60, this is a meaningful consideration. The fix is simple. Cook mushrooms fresh and eat them the same day. If you do have leftovers, refrigerate them immediately after cooking. Use them within 24 hours and add them cold to salads or grain bowls rather than putting them back in the microwave. Before we move to the final two foods, I want to step back for a moment because there's a pattern worth noticing. Every food we've discussed so far, eggs, fish, mushrooms, is genuinely healthy in its first form. The problem was never the food itself. The problem is the transformation that occurs through reheating. Applying heat to an already cooked food is chemically different from applying it to a raw one. You're starting from an altered baseline. Fats are partially oxidized. Proteins are partially broken down. Bacteria have had hours to do quiet work in the background. And none of this announces itself. You won't feel it after one reheated egg. You won't notice it after a single plate of microwaved leftover fish. The compounds are small, the inflammation is low grade, but it is consistent, and it accumulates. For a body over 60, one that processes toxins more slowly, repairs DNA less efficiently, and has a more permeable gut lining, consistent low-level accumulation is precisely how serious illness takes root. This isn't meant to alarm you. It's meant to give you something actionable, because every food on this list has an easy, practical alternative. Food number 4, processed and cured meats. Ham, bacon, deli turkey, sausage, hot dogs. These are convenient, protein-rich, and genuinely popular because they're quick and easy to prepare. But they carry a specific chemical risk that exists even before you reheat them. And reheating makes that risk significantly worse. Processed meats are preserved with nitrites, sodium nitrite specifically. These compounds act as antimicrobials, give processed meats their characteristic color, and extend shelf life. In moderate, isolated consumption, the body handles nitrites without dramatic consequence. Here's where reheating changes the equation. When nitrite-containing meat is heated, and especially reheated, the nitrites react with the proteins and amino acids in the meat to form a class of compounds called nitrosamines. This is not a fringe or contested concern. Major cancer research organizations have classified processed meat in the highest risk category based largely on the nitrosamine connection. And nitrosamines form most aggressively at elevated temperatures. Every time you reheat leftover ham in a hot pan or a microwave, you're generating a fresh surge of these compounds. Where do nitrosamines cause harm? Primarily in the stomach, colon, and esophagus. They don't only threaten cellular health either. They attack the inner lining of blood vessels in much the same way as the oxidized fats we discussed earlier, driving vascular inflammation, contributing to plaque formation, and elevating cardiovascular risk over time. After 60, there's an additional complicating factor. Stomach acid naturally becomes less potent with age. That means nitrosamines are less efficiently broken down during digestion and more likely to be absorbed into the bloodstream intact. The practical approach here has 2 parts. First, reduce processed meat overall and favor fresh, unprocessed protein sources when possible. Second, if you do eat processed meat, eat it cold, straight from the fridge. A cold slice of turkey on a whole grain cracker is fundamentally different from that same slice blasted in a microwave. Cold minimizes further nitrosamine formation. Heat accelerates it. Food number 5, starchy vegetables cooked in oil. I've saved this one for last because it tends to catch people completely off guard. It involves a food category that nearly every senior health guide enthusiastically recommends. Roasted vegetables, carrots, sweet potatoes, parsnips, zucchini, beets, roasted in olive oil, seasoned with herbs. It sounds like the very definition of healthy eating, and it is healthy the first time around. Here's what changes when you reheat them. When you roast vegetables in oil at high temperatures, the oil undergoes partial oxidation. Some of the beneficial properties of that oil, especially the polyphenols in olive oil, get degraded in the process. Now you have leftover vegetables sitting in oil that's already in a compromised oxidative state. You put them in the fridge, pull them out the next day, and reheat them in the microwave or the oven. You've just applied heat to oil that was already chemically stressed. The aldehydes that form during oil reheating are well documented. They're reactive, toxic compounds that cause genuine damage to arterial tissue. They don't just make food smell off, they're biologically harmful. But there's a second hit specific to starchy vegetables like sweet potatoes, carrots, and parsnips. When these foods are cooked and then cooled, something beneficial actually happens. Some of their starch converts to resistant starch, which behaves more like dietary fiber. It feeds healthy gut bacteria, slows glucose absorption, and results in a gentle rise in blood sugar with a modest insulin response. When you reheat those vegetables, that resistant starch converts right back to regular digestible starch. Glucose enters your bloodstream more rapidly. Insulin spikes. For someone over 60 with any degree of insulin resistance, which applies to the majority of older adults, these repeated glycemic spikes generate oxidative stress in blood vessel walls, accelerate arterial stiffening, and contribute directly to cardiovascular risk over time. So you're dealing with a double hit. Aldehydes from reheated oil attacking your arteries from one direction, and a sharp glycemic spike attacking them from another. The smarter approach, roast only what you plan to eat that day, or roast without oil and add a small drizzle of fresh olive oil after the fact. For leftovers, eat them at room temperature or cold, tossed into a grain bowl. The cold temperature preserves the resistant starch, and the absence of additional heat prevents further oil oxidation. Simple and effective. Let me bring everything together because I want you to leave this video with something concrete you can use starting today. Eggs. Cook them fresh every time. 3 minutes is all it takes, and it's not worth the oxidized cholesterol risk that comes from reheating. If you absolutely must reheat, use the stovetop over low heat. Never a microwave. Fish and seafood, eat it the same day it's cooked or enjoy leftovers cold the next day. Cold omega-3s are intact omega-3s. Reheated omega-3s become oxidized lipids. Let the fish stay cold. Mushrooms. Cook and eat the same day. Leftover mushrooms belong in a cold salad, not back in the microwave. Refrigerate immediately after cooking and never leave them sitting out. Processed meats. Minimize them overall, and when you do eat them cold. Never reheat in a pan or a microwave. Cold minimizes nitrosamine formation. Heat maximizes it. Roasted vegetables. Cook only what you'll eat, or eat leftovers cold in a bowl. Don't reheat oil-coated vegetables. Add fresh olive oil after cooking rather than before, and you'll preserve far more of its benefits. None of these changes ask you to eat differently. They simply ask you to think differently about timing and temperature. And those shifts, stacked together over weeks and months, meaningfully reduce your chronic inflammatory load. That reduction shows up in your blood work. It shows up in your energy levels. It shows up in your blood pressure readings. Small daily decisions, compounded over time, are among the most powerful forms of preventive medicine available to us. I've spent enough years in this field to know that the most important health decisions don't happen in a doctor's office. They happen in the kitchen at 7 in the evening when you're deciding whether to cook something fresh or just reheat what's already in the fridge. They happen at 8 in the morning when you're warming up last night's eggs. Those moments matter, especially after 60, when the body's margin for error has narrowed and the compounds from reheated food linger longer and cause more cumulative damage than they would have a decade earlier. You're watching this video because your health matters to you, and you're asking exactly the right questions. The adjustments we've covered today don't require a prescription or a dramatic lifestyle overhaul. They require 5 small, practical shifts in how you handle specific foods. Make those shifts, and you're actively reducing the chronic inflammation that sits at the root of the most serious health threats facing adults over 60. If this video gave you something valuable, please take a second to like it and subscribe to the channel. We put out helpful, honest health content every single day, and we'd love to keep you informed. Share this with someone you care about who might be reheating these foods without realizing the risk. Not to worry them, but to give them the same information you now have. The kitchen is one of the most powerful health tools you have. Now you know exactly how to use it. The content in this video is intended for general educational purposes only and is not a substitute for personalized medical advice. Please consult your own physician before making any changes to your diet or health routine.